Childbirth is a universal symbol of hope and new beginnings. Yet for far too many women in Nigeria, this moment of joy is overshadowed by fear. Nigeria holds one of the highest maternal mortality rates in the world, where 1 in every 5 maternal deaths globally occurs. According to the World Health Organization, many of these tragic outcomes can be avoided if complications are identified early. The delay in the decision to seek care and in receiving adequate care in health facilities, often referred to as the first and third delays, become the critical gap between life and death for many mothers. These delays stem from various factors, including gaps in patient knowledge on when to seek care, high patient wait times, inadequate health worker training, insufficient funding, and a lack of essential resources at the facility level, leaving pregnant women vulnerable at the time they need care the most. The forom program implementation has led to a 68% reduction in maternal mortality at program health facilities using a 4-pronged approach: health financing, digitization, capacity building, and community engagement.
Forom program funded by MSD for Mothers, which is implemented by Solina in collaboration with other partner organizations, including Helium Health. Started since 2022. We started implementation in January 2023 precisely. The forom program aims to improve maternal health indices as well as child health indices across select health facilities within Lagos State, Kano State, and recently Delta State as well.
In trying to actually give maternal care, facilities need to have the right infrastructure, they need to have the right equipment, they need to have the right drugs in store, they need to have the right people in the facilities, etc. There is already a low spending when it comes to healthcare in Nigeria. Also, there is over $100 billion deficits or spending deficits in healthcare globally. So facilities do not have the funding to actually purchase infrastructure, purchase equipment, to actually aid giving adequate or standard care. For the forom project, we provided funding through the Helium credits for health professionals.
The forom consortium has implemented life-saving interventions, from offering loans for much-needed equipment and commodities, to digitizing health facilities for faster, more efficient care, to transforming how healthcare workers care for mothers by building their capacity and incorporating women's needs and voices into the services being provided by health facilities. These interventions are giving mothers the fighting chance they deserve.
On the in-class learning, we've been able to build the capacity of health workers across 109 health facilities. The capacity building focuses on clinical management practices, focuses on financial management practices, as well as operational procedures within the health facilities. Not only that, we've also been able to provide opportunities and platforms for e-learning, the safe care learning methodology. With this, we've onboarded 88 health facilities that are currently participating in this. And to complement all of this, we have the on-the-job coaching, whereby our staff go to each of the health facilities to build their capacity on the clinical management practice as well, to show them how it's done, and also to follow up with them on other quality improvement measures agreed with the health facilities. So a combination of all of this helps to keep the facilities capacitated, but also to help them improve in their maternal health care.
Àkọ́kọ́ mi retí máa bímọ sí ibi báyìí because mi ti lọ sí hospital wọn rí. Ọmọ mi ọmọ oṣù méje ni. And ìgbà tí mo gbé mi wá sí ìbàyìí ní alẹ́ ọjọ́ Wednesday last week. Mi expect nǹkan tí mo bá rárá bóyá ṣiṣẹ́ takuntakun Ọlọ́run dẹ̀ fún wọn ṣe. Ni mo fi bí ọmọ yẹn ní alẹ́ ọjọ́ Wednesday yẹn. So ọmọ náà dẹ̀ wà láàyè. Ó wà nínú incubator báyìí tó ń tọ́jú ẹ̀, tó dẹ̀ ń fún ní ìtọ́jú tó péye dáadáa. and through ẹ̀gbọ́n ọkọ mi ìyàwó ẹ̀ ló introduce wa sí hospital yìí through wọn ni wọ́n fi refer wa sí bíbá so ó dẹ̀ ṣiṣẹ́ takuntakun tọ́jú tó pé wọ́n fún wa lásìkò àwọn nurses wọn náà wọ́n attend sí mi lásìkò tí mo fẹ́ doctor wọn náà wọ́n attend sí mi lásìkò tí mo fẹ́ so mo like the fact pé wọ́n tẹ̀ ń take care èmi àtọmọ yẹn inú mi dùn sí ẹ ṣé púpọ̀.
Before we came in contact with the forom program, hospital requires financial resources, and these financial resources are sometimes very difficult to come by. So we met the forom and we were able to get financial support to fix some things. Now, before the program, we were having certain challenges that range from eclampsia, obstructed labor, and so on. But difficulty to get test results at the right time. So because of this, we collected this facility and we were able to establish a sound laboratory where we can run a minimum of 60 different types of tests. And this has really supported us or helped us in carrying out different laboratory tests for patients that want to do cesarean section for, or patients who are on antenatal or emergency patients, to get results at the right time for us to be able to give them the best services that we can give. In our laboratory today, we have different types of machineries. We have the hematology machines. We can run chemistry tests. We can run serology tests. We can run chemical pathology tests. And these machineries and equipment were bought from the financial support we get from the forom program.
The forom program came at a point when we needed to step up activities in the hospital because we were having some challenges with administration of our patient information system. So we're used to the card-based system, and with the increase in patient turnout, we needed to have a better and faster means of attending to patients without delays and errors in looking for patient files. So that's why we had to join the forom program.
Forom came with a support in cash and in training. I was opportune to attend one of the training, sometimes 2023, I think, if I'm not mistaken. And in that training, we were able to be exposed to the modern practices, which had helped us really good to impart that to our staffs, and more so in the aspect of service rendering. We're able to give the best service to our patients. In that, they now know their rights. We were able to know that, okay, patient who has a right, not you dispensing the service that has all the old. So we were able to make them know that, okay, you have your right to do this, you have your right to do that, and that had propelled us to giving the best to them. And even if we're not up to task, they call us back to say, no, hey, you told us we'll do this. So I think the training has really helped, really too.
A lot of our patients have noticed the positive changes in our care. And some of them have mentioned that our care is more organized and our staff are more attentive and respectful now. One of the patients even mentioned that she feels safe delivering her baby with us because the nurses explained every step to her and ensured that she was informed throughout the process. So there are a lot of similar positive feedbacks we received from patients.
So far, the forom program has provided $731,000 in loans to health facilities for infrastructure and equipment upgrades. It has digitized over 96% of program facilities, reducing wait times and improving data management, and trained 726 healthcare workers to deliver better care to women in these facilities. Through community engagement, the program has reached over 100,000 women through 86 town hall meetings across Delta, Kano, and Lagos states. The For Mom program is keen on providing resources to new health facilities if they enroll on the program to ensure quality maternal health care is more widely accessible.
We in Afrida had a unique role of creating demand for the services provided by these facilities. Because of this creating demand, we also had to make the women's voices heard in this project. We also had the role of linking the community women with these facilities. And in the course of our work, we had to have a deeper understanding of the knowledge, attitude, and practices of these women as it relates to reproductive health. In the course of working with these women, we got to understand their knowledge, their attitude, and practices, and some of the cultural variances that exist in many of the places we had to do work.
Na ji daɗi ƙwarai da gaske saboda na yi tambayoyi ni kaina kuma an bani amsa da na gamsu na fahimta na gane. Na ji daɗi sosai. Akwai ƙaruwa da wayar da kai. Kira nake yi da in dai sun ji irin wannan damar su yi ƙoƙari su fito su halatta saboda akwai ƙaruwa. Akwai bayanan da in ka ji ka bi su to mace ta tseratar da kanta daga samun wani shiga haɗari a lokacin ciki ma kuma bayan haihuwa. Ƙaruwar da na samun ilimin da na ji daɗi gaskiya. Kuma idan an musu tambaya suna amsawa sosai su yi bayani yadda mutum zai gane.
For Mom reminds us of the power of collective action to create safer, high-quality care for mothers and children. Join us in saving lives and building a future where no woman has to die while giving life.